All right, so now we're going to do our first injection. And this is my not so volunteering person. Now she's actually volunteering. This is Chelsea. She works in our lab here in Las Vegas. And I just want to kind of show you, on somebody who would have a much better tummy than I would if I were to show you, exactly how we're going to do these shots. Now I say tummy, but there's actually two places where we can do this. This is subcutaneous. That means it's going to go in the fat. Two choices. And I don't care which one you choose. You can try one area, and if you like it, stick with it. If you don't, you want to rotate it, or you just rotate it all, I don't care. Doesn't matter where you do these. Subcutaneous injections are done in two places. One, they're done anywhere in the tummy, and I'll show you, Chelsea, if I can just show here. Anywhere where you can pinch up a little bit of fat on the tummy. Now, over here, if you want to go up here, stay at least an inch away from the belly button. It gets kind of tender in here. So come down here, but you can see all I'm looking to do is just pinch up a little bit of fat. Now, the second place you can do it is anywhere here on the upper thigh. Usually on here, the upper thigh, we can always, even if you're little, you can pinch up a little bit of fat here. So again, up to you, pinch it somewhere on the upper thigh or anywhere on the tummy. All right. Now, there is no better way. There's no, I'm going to get better absorption or I'm going to get better results. It's getting absorbed into the fat, and eventually into our bloodstream. So it's whatever you're comfortable with. All right. So now we've got our Lupron still all ready to go. I'm going to find a place to do this, and we'll say we're going to hold that there for me, Chelsea. Okay. I'll pick a spot here and always clean it with alcohol. Now, I'm really not going to do this, so don't worry. All right. We're ready to go. Now, when I tell you there is no fancy technique here, there's really no way you can screw this up. Okay, if that needle went in and you pushed that plunger down, you did just fine. So don't stress about that. Errors happen because maybe I didn't draw it up right, I didn't mix it correctly. I need you paying attention there, but you can't really, as much as we stress about it, you can't really mess up these little injections. So I've got my spot all clean and ready to go. Again, you can do this yourself or have somebody certainly doing it for you. You're just going to pinch up the fat, and I'm all business about these shots. I don't take it slow. There you go. And no fancy angle, and just straight in. And we're just going to push that plunger down. That's how you do a subcutaneous injection.